sin of using Q-tips, what we call cotton buds in the UK, to try and remove the wax, and all they managed to do was the reverse, the opposite. They really impacted it, and you can see where the cotton bud has embedded against the wax. There's an indentation there. So we're just starting off on the right here. This wax is quite dry around the edge and at the surface. In the core, it's a bit softer, and you'll see that in a moment when I use an ear hook to try and remove this. The ear hook kind of, more than pull the wax out, it sliced through the wax and dissected it, a bit like a hot knife through butter. So this is the hook. There's a bit of an opening at the top that I created using the Zollner suction probe. So it's performing microsuction with the intention of just lifting this wax off the anterior canal wall. So the wax on the periphery was quite dry, but when I embedded it into the core of the wax, it's a bit softer, and it just diced through the wax. So instead of removing it, it just cut into little pieces. Sometimes that can also help, because we can almost use a hammer and chisel effect. We can break up the wax into little pieces and then use microsuction to remove. So I'm just trying to manipulate the wax with the ear hook. I'm just trying to go at the base of the ear canal there. And again, I'm going to, I think, insert it posteriorly to the back part of the ear canal. Now we are quite deep in the ear. We are on the bony part of the ear canal, so we're going to be really, really gentle here. Again, I've managed to rotate the tip of the hook into the core, the body of the wax and skin plug, but it just dissected it. So I'm just using microsuction just to suction some of this debris that I've created. So it's just suctioning some of the looser bits of wax and skin. You see there's a lot of keratin in the core. You can tell by their colour. It's a very glossy appearance, and typically that's more dead skin as opposed to earwax. Although 60% of earwax is actually composed of dead skin. But I would say this wax plug has got a higher concentration of dead skin, or what we call keratin, probably 75-80%. So I'm just going to put some olive oil drops in there just to lubricate around the plug of wax and skin. And at the same time, I've developed this new technique where I actually, more often than not now, perform microsuction whilst the drops is in the ear. I just think it gives me better results. Can be a bit more tricky at times because you can get a bit of blurring. And again, I'm just trying to elevate this off the canal wall, so to detach it, to mobilise it. So the patient did a really good job at impacting this really deep in their ear. So I've managed to get a suction grip at the base and slowly coming out with the suction probe, trying not to lose the suction grip against the wax plug. You can see it's quite a fair size. You can see the keratin that's coating it, it's enveloped the wax. The patient's got a healthy eardrum, but they have traumatised the back part of the ear canal. You should have seen there's a bit of a blister, and that's purely because of the Q-tip pushing the wax against the canal wall. We're on to the patient's left ear. Again, you can see where the patient had used a cotton bud. In fact, some of the wool fibres have embedded into the wax. I'm just using a hook. I'm just going posteriorly and superiorly to the top part of the ear canal with this little gap. Again, we are quite deep here. We really are in the bony part of the ear canal, probably about 2 centimetres into the ear canal. So the ear canal on average, if we say it's 3 centimetres, so I'm 2/3 into the ear. Just coming out of the ear hooks. I've got a lateral plug of wax out there. And this is beyond the second bend. We can just see the second bend of the ear canal to the left, where the ear canal then straightens. So again, just using microsuction, just got under the slither of keratin. And I'm going to put some drops in a moment, similar to the right ear, to mobilise it, to lubricate the plug of wax. Here I'm just trying to lift it off the base of the ear canal and wriggle at the same time. But it's well and truly impacted past the second bend. There's the drops, and again, once more, I'm suctioning whilst the drops is in the end. Can blur a bit, so just be a bit careful. When it blurs, you just come back out, clear some of the excess oil, and then go back in. We've got the patient's head tilted slightly across, so the ear is facing towards the ceiling. So that way the drops is penetrating whilst I'm suctioning. Previously I used to put the drops in, let it soak for a few minutes, and I still do use that strategy now and again. It just depends on the procedure and the requirement. and then I would drain the oil out of the patient's ear before re-entering, but more and more allowing the drops to settle, and I'm suctioning at the same time. So it's a really dry plug of wax and keratin. You can see the mark where the cotton bud has gone in, it's really circular there. And once more, it's enveloped by some keratin, some skin. So I'm just going to mop up some of this residue of the canal wall. So this is on the cartilaginous portion, the outer third, so we can put a bit more pressure if we like here. It's less sensitive than the inner 2/3 of the ear, where it's just a very thin layer of skin attached to bone. We've got some wax keratin just hiding laterally, so near the entrance, and posteriorly. Quite often there's a bit of a blind spot here, but with an endoscope we can really visualize it and remove it. And in a moment you're going to see the patient's eardrum, which is nice and healthy. And then I've got some still images of some of the wax plugs. So this is from the patient's right ear, the first ear that I performed. You can see the keratin at the bottom, the fresher layer of keratin. And then as you go into the core, the shades of brown get darker and darker. That's because this keratin is oxidized.